Low carb diet for UTI, burning feeling while passing urine, or pain in the belly. Have you ever had a urinary tract infection that just keeps coming back no matter how careful you are? If you have diabetes or high blood sugar, your daily diet may be playing a much bigger role than you think. Today, we will look at how a low-carb diet may help support urinary tract health, what foods to eat, what foods to avoid, and what research says about it. Many people think a UTI is only caused by poor hygiene. However, that is only part of the story. Blood sugar levels, your immune system, hydration, and even the foods you eat can all influence your risk of getting repeated infections. If you have diabetes, this information is even more important. People with diabetes have a higher risk of UTIs because high blood sugar can make it harder for the immune system to fight bacteria. Keeping your blood sugar under better control may help reduce that risk. A urinary tract infection happens when bacteria enter the urinary system. The infection usually starts in the bladder, but if left untreated, it can spread to the kidneys. That is why it is important to recognize the symptoms early. The most common bacteria causing UTIs is called E. coli. It normally lives in the intestines without causing problems. Once it enters the urinary tract, it can multiply quickly and trigger an infection. The first signs often include a burning feeling while passing urine, needing to urinate more often, passing only small amounts of urine, cloudy urine, strong smelling urine, or pain in the lower abdomen. Some people also notice blood in the urine. If the infection reaches the kidneys, symptoms become much more serious. You may develop fever, chills, nausea, vomiting, or pain in your back below the ribs. If that happens, seek medical care immediately because kidney infections can become dangerous. Many people wonder whether eating fewer carbohydrates can actually cure a UTI. The simple answer is no. A low-carb diet cannot kill the bacteria causing the infection. Antibiotics are usually needed to treat bacterial UTIs. But a low-carb diet may help your body in another important way. It can improve blood sugar control, especially in people with diabetes or insulin resistance. Better blood sugar control supports your immune system and may lower sugar in the urine and the chance of repeated infections. When blood sugar stays high, extra glucose may spill into the urine. Bacteria happily use that glucose as food, helping them grow more quickly and easily inside the urinary tract. That is one reason repeated UTIs are more common in people whose diabetes is poorly controlled. Research also shows that high blood sugar also reduces the ability of white blood cells to fight infections. These cells are your body's natural defense system. When they do not work well, bacteria have a better chance of multiplying. This is where a low-carb eating plan may help. By reducing foods that quickly raise blood sugar, you can often keep glucose levels more stable throughout the day. That gives your immune system a better chance to work effectively. So, what exactly is a low-carb diet? It simply means replacing sugary and starchy foods with foods that are rich in protein, healthy fats, and low-carb vegetables. It is not about starving yourself. It is about choosing foods that nourish your body without causing large blood sugar spikes. Protein should be one of the main parts of your meals. Eggs, chicken, fish, turkey, lean meat, tofu, and plain Greek yogurt provide excellent nutrition while containing very little carbohydrate. Protein also helps repair body tissues and supports the immune system. Healthy fats are another important part of a balanced low-carb diet. Olive oil, canola oil, avocado, nuts, beans and legumes, and oily fish provide long-lasting energy and help you stay full between meals. They also do not cause sudden increases in blood sugar. Vegetables should fill a large part of your plate. Spinach, broccoli, cauliflower, cabbage, zucchini, cucumber, lettuce, mushrooms, green beans, and capsicum are excellent choices. They are packed with vitamins, minerals, antioxidants, and fiber, while staying naturally low in carbohydrates. Fiber deserves special attention. Although fiber is a type of carbohydrate, it is not digested the same way as sugar or starch. Fiber supports healthy digestion, feeds beneficial gut bacteria, and may help strengthen the immune system. Good low-carb sources of fiber include leafy green vegetables, chia seeds, flax seeds, almonds, walnuts, and other nuts. Eating enough fiber may also improve blood sugar control over time. One of the simplest things you can do during a UTI is drink enough water. Water helps dilute the urine and encourages more frequent urination. And this may help flush bacteria from the urinary tract. Some people avoid drinking because urination is painful. But drinking too little water usually makes urine more concentrated, which can increase discomfort. Staying hydrated is usually the better choice unless your doctor has advised you to limit fluids. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Tell me in your comments what foods are your favorites. Now, let us talk about one of the biggest myths surrounding UTIs, cranberry juice. Many people believe cranberry juice cures infections. That is not true. Research suggests cranberry products may reduce the risk of repeated UTIs in some people because they make it harder for bacteria to stick to the bladder wall. But they do not kill bacteria, and they do not replace antibiotics. There is another problem with cranberry juice. Many commercial products contain a large amount of added sugar. If you have diabetes or follow a low-carb diet, that extra sugar may outweigh any possible benefits. If you want to use cranberry products, sugar-free options or cranberry supplements may be better choices. Always discuss supplements with your healthcare provider, especially if you take blood-thinning medicines. You may also have heard about probiotics. Research suggests healthy bacteria may help maintain a balanced urinary and digestive system. Foods like plain yogurt with live cultures, kefir, and fermented vegetables without added sugar can be included if they suit your eating plan. Vitamin C-rich vegetables are another smart choice. Broccoli, cauliflower, Brussels sprouts, and capsicum provide vitamin C while keeping carbohydrate intake low. Vitamin C supports normal immune function, although it does not cure infections. Garlic has received a lot of attention because laboratory research shows it has natural antibacterial compounds. But eating garlic alone will not treat a UTI. It is still a healthy ingredient that can easily be added to many meals. Some foods and drinks may irritate the bladder during an infection. Coffee, alcohol, sugary soft drinks, spicy foods, and energy drinks make symptoms worse for some people. If you notice this happens to you, try reducing them until you recover. If you have diabetes, continue checking your blood sugar regularly during an infection. Illness often raises glucose levels, even when you are eating carefully. You may need advice from your healthcare provider about adjusting your treatment while you recover. People taking SGLT2 medicines should also be aware that these medicines increase glucose in the urine. Research shows they can increase the risk of genital yeast infections, while the increase in bacterial UTIs appears to be small for most people. If you have repeated infections, discuss this with your doctor. Here are some foods that fit well into a low-carb eating plan during a UTI. Eggs, fish, chicken, turkey, lean beef, tofu, spinach, broccoli, cauliflower, cabbage, lettuce, cucumber, zucchini, green beans, mushrooms, capsicum, avocado, olive oil, almonds, walnuts, chia seeds, flax seeds, plain Greek yogurt, if suitable for you. Foods that should be avoided include sugary drinks, fruit juice, cakes, pastries, sweets, white bread, white rice, breakfast cereals with added sugar, and highly processed snack foods. These foods can quickly raise blood sugar and provide very little nutrition. Good daily habits also help lower the chance of another infection. Do not hold your urine for long periods. Drink enough water every day. Pass urine after sexual activity. Wear clean, dry underwear. Change out of wet clothing as soon as possible. These simple habits can make a real difference. Always complete the full course of antibiotics if they have been prescribed. Stopping treatment early may allow some bacteria to survive and build their own defense, increasing the risk that the infection returns. If your symptoms do not improve within 2 days after starting antibiotics, or if you develop fever, chills, vomiting, severe back pain, or confusion, seek medical care immediately. These can be warning signs that the infection has spread. Research from respected organizations, including the American Urological Association, the European Association of Urology, the American Diabetes Association, and the National Institute of Diabetes and Digestive and Kidney Diseases, supports the importance of good blood sugar control, healthy nutrition, proper hydration, and timely medical treatment for urinary tract infections. A low-carb diet is not a cure for a urinary tract infection, but it may become an important part of preventing repeated infections, especially if you have diabetes or insulin resistance. Combined with antibiotics when needed, healthy daily habits, and good blood sugar control, it gives your body the best chance to recover and stay healthy. If you found this video helpful, share it with someone who struggles with repeated urinary tract infections or diabetes. It could help them understand that small changes in everyday eating habits may make a big difference over time. Thanks for watching. See you in the next video. Thanks.